into the ureter or kidney. Ureteroscopy is used to remove kidney or ureteric stones and enables a direct view of the ureter and kidney to confirm or rule out other abnormalities. This animation shows the removal of a kidney stone. Ureteroscopy is typically performed with the patient under general anesthesia. A small tube is passed through the urethra into the bladder, and from there up into the ureter and into the kidney. A contrast study may be performed to assess the anatomy of the renal collecting system before stone removal. A contrast agent, or dye, is administered through the tube into the ureters. X-ray images clearly outline the urinary channel and exact position of the stone. A so-called safety wire that helps guide the ureteroscope through the ureter is inserted. Depending on the location of the stone, a rigid or flexible ureteroscope is passed through the urethra into the bladder, following the safety wire into the ureter, the small tube that drains urine from the kidney to the bladder. Once the stone is located, it may be pulled out directly with a so-called stone basket, or a laser is used to break the stone into smaller pieces before extraction using the basket. After stone extraction, the collecting system is checked to ensure that no residual stones have been missed. Your doctor may place a temporary small tube, called a stent, within the ureter at the end of the procedure to ensure that swelling does not block the drainage of the urine. A catheter, which is a tube placed through the urethra into the bladder, may be used to drain the bladder. This catheter remains in place with the use of an inflated balloon. The catheter and stent are usually removed shortly after the procedure. You can leave the hospital once you are able. You are placed on an operating table with your flank positioned towards the shockwave generator. Imaging with X-rays or ultrasound might be performed to pinpoint the exact location of the stones. Focused shock waves are then transmitted to the stone through the skin. The stone absorbs the energy of the shock waves and breaks into pieces as small as grains of sand. Because of their small size, these pieces can pass easily from the body along with the urine when you go to the toilet after the procedure. The procedure lasts about 45 minutes. If you have a large stone, it is quite common that you need multiple sessions to completely break it. Your doctor will inform you on the needed course of treatment. After the procedure, your doctor will see you for a follow-up to check if the stone completely broke up and got flushed out with the urine. You will be given a urine strainer to catch the bits of stone passed in your urine for further examination. Sometimes a stone fragment can temporarily get stuck in the ureter on its way down. This can cause some blood in your urine, congestion, and even pain. If you are in pain, use the prescribed painkillers and temporarily drink only small amounts to minimize the congestion. Contact your doctor if you develop fever. The goal of this procedure is to remove all your kidney stones and, when present, ureteral stones. This animation shows the removal of stones in the kidney. PCNL is carried out under general anesthesia. When you are fully sedated, a catheter, which is a hollow tube, is placed in the bladder. The bladder catheter drains the bladder and remains in place with the use of an inflated balloon. Another catheter is placed up into the ureter. Through this catheter, a contrast, dye, may be instilled to allow a better view and exact stone location, and to facilitate access to the kidney while your urinary tract is visualized using X-rays or ultrasound. Once the stone is located, access to the collecting system of your kidney is gained using a thin needle. This access route is carefully dilated. The guide wire allows the nephroscope to safely access the kidney. Some stones can be removed directly using a grasper. Larger stones need to be fragmented first, using a device like a laser before extraction. After removal of all the stones, your surgeon will perform a contrast study. When there is good passage of contrast material to the bladder, this means that the ureter is also stone-free. In some patients, a temporary small tube, called a double J stent, may be placed to ensure that swelling does not block the drainage of the urine. The stent remains in place by J-shaped curls in both the kidney and bladder. At the end of the procedure, a nephrostomy may be placed. This catheter helps to drain your urine. The catheters and stent are usually removed shortly after the procedure.
The prostate gland is a walnut-sized organ, which is part of your reproductive system. It provides some of the fluids contained in semen. The prostate is located just under the bladder and behind the testicles. The urethra, the hollow tube that carries both urine and semen to the penis, passes through the prostate. In some men, the prostate gland becomes enlarged. Symptoms of an enlarged prostate include a full bladder feeling even when the bladder is empty, pain when urinating, weak urinary stream, infertility, and sexual dysfunction. To relieve you and your symptoms, your doctor feels that you would benefit from a surgical procedure called TURP. TURP is designed to relieve symptoms by reducing the size of the prostate. It is also a diagnostic procedure. Tissue removed during a resection of the prostate, or TURP, is routinely screened for the presence of cancer. Your doctor will then lift your penis upward. A well-lubricated instrument called a resectoscope is then gently inserted into the urethra. When the resectoscope reaches the back of the penis, your doctor will pull the penis downward in order to create a straight path into the prostate. Once the instrument is inside the prostate, your doctor will extend a small loop of sharp-edged wire from the end of the resectoscope. Using this tool, your doctor will then scrape excess tissue from the prostate, restoring it to its normal size. Tissue removed from the prostate may be sent to a laboratory for analysis. When the surgery is complete, your doctor will remove the resectoscope. Your doctor will probably ask you to wear a temporary Foley catheter. A Foley catheter is a narrow tube inserted through your urethra and into your bladder. The catheter is connected to a bag that is attached to your leg by a strap. While the Foley catheter is in place, urine will pass from your bladder into the bag. You will not need to urinate into a toilet. The nurse will show you how to change the bag when it's full. An appointment will be made for you to return to the doctor's office in a couple of days to have the catheter removed. As soon as the anesthesia wears off and you feel comfortable, you will be allowed to leave.